So,
Monica, you're here with us at the Gold Program for your first treatment. Can you state your full name?
Yep, my name is Monica Weiss Sharp.
And your age?
I am 33.
And why are you with us today?
Yep.
What brought you to our program?
Yeah, the primary symptom that I'm dealing with right now is some ongoing neck pain. I guess it's been going on about 4.5, maybe getting close to 5 months at this point of not having really gotten any complete relief. It's been waxing and waning in terms of how intense it's been, primarily the right side of my neck and into the shoulder. I've had some previous issues with my neck probably for a couple years that I've been sort of acutely aware of, but this is definitely the most significant kind of period of time where, like I said, it's never really been right during that time period.
Mm-hmm.
Yeah.
Is it a result of injury?
It's not the result of a specific injury. I think it's actually more a chronic use issue. I transitioned a few years ago to having more of a desk job. I'm also in school, so I think the combination of that, having my own personal issue with my addiction to my cell phone and a lot of computer work, a lot of book work, and I have had some other kind of, I guess, musculoskeletal or spinal issues previously and have done chiropractic and massage for that. But in terms of my neck, no specific like accident in terms of a car injury or fall or car accident or fall or anything like that.
Okay.
Yeah.
So, growing up, what sort of physical activities?
Yeah.
Anything you think could have related?
Yeah. I've ridden horses pretty much my whole life. So there's all kinds of impact on my spinal column as a result of that. And I will say I have fallen off horses before. It's been quite some time since that has been an issue, but that is what has led me to chiropractic care and some massage therapy in the past. That was, the focus there was definitely more my low back. Couldn't say that hasn't impacted my neck, but wasn't a main primary area of concern at those times. And when I say a good while ago, it's probably been close to 15 years since I've had a fall, but have continued to ride horses. Have not ridden as much the last 1.5 to 2 years, just as school and work have kind of superseded, but that I would say has kind of been the primary physical activity beyond like walking, hiking, things like that in my life.
Mm-hmm.
Yeah.
Any medications?
I do take Allegra for seasonal allergies, and I have been taking ibuprofen off and on just because sometimes these neck issues, I have been having trouble sleeping because of the discomfort.
Are you currently seeing a chiropractor?
I had been, but I was not feeling like I was getting much results, so I guess I tried a couple different times in the last 5-month period, but I really was not creating much of a difference, so I stopped a few weeks ago.
Has there been anything, you said you did some massage stuff, has anything helped it?
No. I mean, no, I can't say that like I went to the chiropractor for a while or got a massage and then felt relief for a week. I mean, if anything, I just feel like it's more like what I have happened to be doing maybe aggravates it more or less. But I don't think that any of the specific therapies I've tried have had a definitive impact in this 5-month period or so.
So, no daily workout routine, no stretching?
I have done, in seeing Dr. Forbes for this issue, he did recommend just some gentle stretching on a daily basis. I have been doing that. Not like a specific routine, I guess, but he just said to kind of find the point of tension and just relax into that for 30, 45 seconds and then gently release. So I have been doing that.
Do you find it's helped any?
I can't tell, again, because like some days are better than others, and I haven't found a pattern that's like, if I did or didn't do this, it's better or worse, I guess, if that makes sense. So I feel like there's some underlying thing that's not getting addressed.
Mm-hmm. Do you find like if it's a tense day or stressful day, it's more so?
Probably. I would also say my stress level is generally pretty high right now, so I'm sure that's a contributing factor, but I can't say like, oh, on my really easier days, it's so much better. I can't say I've had a whole lot of easier days in that time period. So.
When is your neck the worst? When do you notice it's the worst?
I'm probably sometimes when I'm sitting, I'm probably honestly most conscious of it when I try to sleep. Mm-hmm. And I'm not necessarily sure that it's actually worse, it's just that...
You're aware of it.
Yes. But yeah, I would say sometimes when I'm sitting, but it just sort of, there's some days that are worse than others. Some days where I can feel that some nerve impingement's happening because I can feel it in my bicep. Those are the worst days, but it's not necessarily associated with I sat a lot more or I moved around a lot more or anything like that. that I've been able to
He's
connect.
just chronically angry at you.
Yeah, off and on. Yeah, and it's frustrating because I can't figure out like do or don't do that, and then it's better or
Yeah,
worse.
I hear
So
that.
yeah,
Okay.
yeah.
Any surgeries?
No, not other than my wisdom teeth when I was 15.
You have any other pains in your body? Do you get headaches? Do you get upper back pain, low back pain anymore? Knees, feet?
So yes, my right knee gets a little angry at me sometimes and a little crunchy. My left hip and SI joint have been chronic, kind of low grade pain. I will say that's been better since I haven't been riding, but every so often it'll get a little. It's more tightness now than pain, I guess, but I will be aware of it sometimes more than others. Headaches, I have noticed an uptick with the neck stuff. I've had chronically no, but lately I have noticed just kind of what feel like tension headaches, and even some jaw tension as well.
Okay.
Any past history of injuries aside from your horse falls?
No, not particularly.
Any horse falls where you had like a concussion or whiplash or anything like that?
No, it was more impact falling like directly on my tailbone.
Okay.
Yeah.
Alright. Horses scare me.
Really?
Well, I grew up and practiced in the Seattle area, and
Okay.
there's a lot of horses out there, a lot of horse riders. So my
Yeah.
whole practice, out there was just everybody had a horse story. Kicked,
Yes.
thrown, whatever. And
Yep.
it always sounded so random. I was like, I don't want to get near those things.
Yep.
My horse saw the reflection of the sun in a puddle and freaked out and,
Yep.
and bucked me 20 feet.
Yes.
And I'm just not okay with him.
Yeah, that definitely happens, but I mean at the same time, most of mine I can say, well, I was kind of dumb and created that scenario as a possibility.
People always say that,
So-
but after I've heard the story so many times, I'm like, I don't know, man. You just gotta stop putting that horse. Give
Yeah.
yourself-
Yeah, there's definitely a fair point, and I guess it's probably one of those things we justify it because we want to keep doing
You
it.
do,
So-
and you love the animals,
Exactly.
so it's okay.
Exactly.
All right. Well, if you think of anything else, let us know along the way.
One other thing I'll mention, I've done some PT at various points specifically for the left hip and SI joint, and in doing some range of motion, they have said, for whatever it's worth, that my ligaments allow too much play in some of my joints. And one other point of pain that flares up and down is some rib attachments in my right side of my sternum. Sometimes will just be unweighted with me.
Okay.
So
Alrighty.
Yeah. So let me get this real clear real quick.
Yeah.
On a pain level scale right now.
today, sitting here right now, none. If I try to bend like this, that is where I get some pain, or stretch over this way. And it's probably today only at like a 3. It's not bad today. But
Okay.
yesterday it was worse. So
When you say worse, like
probably more like a 5. At some points maybe even a 6 because I did feel it down in my bicep for a few hours yesterday.
okay.
So
Okay.
All right.
And you just want to feel better with this. You want us to resolve this and get you done. And
yeah, I just want to feel functional because right now, right now I just feel like I don't know what I need to avoid doing, or to do more of, and I just would like to feel like I can move normally and be able to sleep normally would be nice too.
Yeah.
So,
Alrighty.
yeah.
Well, let's get started.
Okay.
Yeah, sleep.